Okay, PARCA Clinical Section 5.4 covers prelim report, trauma report, after-hours support using secure connection, router connection, remote reporting, rural clinic access, VNA-based access, web-based access, aggregate work list. And a lot of these were short, so I was able to fit them onto one slide. So a preliminary report is performed based on preliminary diagnosis and is later used for generating the final report. So as we talked about, this might be a report generated by an ER physician that is preliminary, and the radiologist will review it and change it into a final report. Or it might be a radiologist who's waiting for some lab work to come back on a particular case or something. So they'll make a preliminary. When they get other information, maybe they're waiting for outside films, then they'll review it again and make it a final. Trauma report. A trauma case or emergency reporting is carried out under special conditions which require reporting on the radiology exam immediately. So this is a situation where a patient comes into the emergency room and that patient is unconscious. They can't tell you their name. They don't have any ID with them. So let's say they get a head CT. That head CT has to be read out immediately. We can't wait for the patient demographics to be figured out. They need that information to treat the patient immediately, so you might see a report go out with John Doe on it or Trauma Bay 1 has the name on it. After-hours support cases. This deals with situations when the patient arrives late in the evening when there are no staff radiologists available at the institution. So radiologists do go home in the evening. They might be there till 4, 5, 6 o'clock in the evening, but they'll go home. If a complicated medical situation arises, patient comes, let's say the unconscious patient comes in, at 8 p.m., that would be both a trauma report and after-hours support cases. The ER physician is not going to diagnose that. He'll send that to the radiologist to be looked at. So that's after-hours support cases. Remote reporting. The two most common scenarios in which remote reporting can be carried out are using a secure connection to PACS. It's got to be a secure connection. The radiologist has access using a secure connection to PACS, and he can retrieve or pull the images from the PACS to his home viewing station. Or using a router connection. The images are pushed to the radiologist, potentially using a router which determines the radiologist to send it to. And we have rural clinic access. Remote support becomes useful if the reporting is carried out in a rural clinic. There might not be a radiologist present during the whole week, but maybe every other day. So that's where you would use those type of remote access reading when you don't have radiologists on site on a regular basis. VNA or web-based access for non-diagnostic. This is for non-diagnostic review purposes. Many physicians access images through web-based technology from a PACS or a secondary archive, aka a vendor-neutral archive or VNA. So this isn't a way that we would do diagnostic readings, but for clinicians to just review exams, they might use a VNA or web-based access. And lastly is the aggregate work list. Radiologists can also access images from a consolidated or aggregate work list, which builds a work list from multiple PACS systems, which could be from different vendors. So if you're a radiologist and you're reading for a large enterprise like UPMC, you might have a piece of software that is an aggregate work list software that brings in studies from Lidditz, Harrisburg, and Lancaster. You're the radiologist on call that evening. You can read from all of those different places off one work list. That's an aggregate work list. All right, thank you for watching.